Hello, everyone. Welcome to Medicus. My name is Varun. I hope you're all doing well. Today, we have an esteemed guest, Mr. Dr. Manohar Ahuja, who is joining from our Wisconsin office. He's also based in Wisconsin, and he's a practicing nephrologist for more than 40 years in the kidney health area, which is nephrology area. So, we wanted to discuss about kidney health, which is one of the important vital organs in our body. And so, we have him today to discuss some very important topics which you probably may not have seen or heard anywhere online. With respect to kidney health. So, Dr. Ahuja has been practicing internal medicine and kidney health since last 40 years. So, let's welcome him for today's podcast. Dr. Ahuja, namaste, sir. Welcome to our today's recording. How are you doing?
Thank you. I'm doing well. Thank you
Fantastic.
for thank
Great.
you for having
Absolutely,
me
sir.
over.
The pleasure is all ours, sir. So, Dr. Ahuja, I'm sure in the last 40 years, you must have seen a lot of changes in the medical field, especially in the offering, in the provider side, as well as in the public side, the consumer side as well. So, can you give us a little understanding of how have you actually transformed yourself into this medical field, and what made you choose nephrology? How did you go to US? Give us a little bit background about you, sir.
So I've been in United States now for literally over 30 years, and majority of my time has been spent in training and practicing nephrology. That started even before I moved to United States, and the changes that I have noticed in the last 2 3 decades is that the awareness of the kidney disease that was not very common in the days when became doctor has now somewhat increased, especially with respect to the kidney health also. Uh, Awareness in general about the dysfunction of our vital organs of the body or functioning of our human body at a mass level is not very common, either because people are not science oriented, or because they don't have time or interest, or simply there has not been enough background training when we go to the school at earlier level before we go to the college level. And hence, a common man, when he comes to a healthcare provider, simply doesn't have as much knowledge as they ought to have for functioning of their body, such that they can understand when they are afflicted by a condition. And that has been changing over the last few decades, slowly but surely.
Got it, sir. Dr. Ahuja, in your experience of the last 4 decades of you transitioning from India to UK to United States, you must have probably met a lot of people and a lot of patients as well in this journey, right? So, what is that difference you have identified in the public or in the patients in India and UK and the United States, especially with respect to this kidney health?
So, the major difference that I see is that in India, we do not have this system of having a periodic health check, even when we are feeling well,
Okay.
even when we are vulnerable for developing some of those ill healths, either because of the family history or because of the environment that we are working in, etc. While in UK and United States, um, even a healthy person has a primary care physician, even when they don't need them, but they see them at least once a year to 6 months, or they have some periodic health checkups done either for the employment reason or college reasons or other reasons, such that many asymptomatic conditions that they otherwise would not have been aware of can get detected early on as long as the patient is following through. And this is
Perfect.
completely lacking in India. In
Okay.
India and other developing countries, we only go to the doctor when we have an advanced trouble or a manifest dysfunction of our bodily system, as opposed to getting checked out when we could have found something at an earlier stage, simply because we were vulnerable to develop that condition, or because we have a family history for that condition, or because of some other reason we ought to have gone to the doctor, but we didn't because the system doesn't exist.
Okay. I understand, sir. So the primary difference, what you had observed, if I have to summarize, it is for the public not taking care of them or not actually proactively going to test themselves unless they actually fall ill. That is the major change you had observed in the developing countries versus far more developed countries. So we understand that, sir. So, Dr. Ahuja, I'd like to ask you this specific question. This is probably on behalf of a lot of public, especially when we talk about this time period in India, especially in cities like Delhi, Haryana, Chandigarh, and all. There is a lot of smog. The pollution levels globally have risen big time in terms of the air pollution and also the water pollution, and of course the food is already a part of the pollutants that we are talking about. So, but there is no way that we can escape ourselves from existing or remaining in this system and accepting that pollution as a part of our life and coexisting with it. And obviously, we all know that because of these various levels of pollution, one of the vital organs that is going to get damaged is our kidneys. What is your advice to those people where they're living in this highly environmental polluted areas, or it could be water pollution, or especially for those people who are living in Delhi, especially, because we have been seeing this case from past several years. The pollution levels go beyond 700 and 800 and 900 levels. What is your suggestion to them, sir? How do they protect their vital organs? That may be kidneys or any other vital organs.
So, first and foremost, thing that one would want to do is probably remove yourself from that environment, but that's not practically feasible, as you mentioned. So,
Yes, sir.
then, since we are ought to be stuck in that environment, what we can do is at least take good care of ourselves. And taking good care of ourselves means, one is updating ourselves with the knowledge as to what ill effects of the environmental pollution or water pollution may be. Because unless you are aware and you have equipped yourself with the knowledge as to why you need to do something, you won't go to the next step. So I would say, first, reading and learning as to what implications are there of the water pollution and environmental pollution. And then the next step is do what it tells you to do, which is go for a checkup and see that if you have a condition that has developed as a result of the water pollution or environmental pollution. So when it comes to environmental pollution, common problems that can occur is trouble breathing.
Yes, sir.
And you may be surprised that we can live with a lot of reserve in our lungs before it is affected and
Okay.
not have any trouble. And it's
Okay.
only when a lot of lung is affected, then we start having trouble. So sometimes a minor cough or a minor discomfort in breathing, we can attribute to tiredness or whatever and not seek the medical advice.
Right, sir.
So going to the doctor, asking them the right questions, getting yourself checked as to if something is wrong, and then following that advice of the doctor. Too often in developing countries, including India, what we do is just because somebody told us or just because we became alarmed, we go to the doctor and the doctor gives us some advice and we follow it for 15 days because the initial medication or testing that was to be done was going to last only for 15 days. And then we feel a little better. And then we never go back to the doctor. all these chronic conditions that can arise as a result of the water pollution or environmental pollution are not going to go away as long as you are in that environment. And
Okay.
and as a result, you need to follow up with the doctor
Right.
as to whether you got better or not, or whether your condition has progressed,
Okay.
has resolved, or any additional measure is needed.
Needed. Okay. Okay. Got it, sir.
And in addition, I would also say on the engineering side, if water pollution and environmental pollution can be modified by equipping your house or by equipping your car with appropriate modifications that will reduce the water pollution or environmental pollution. I'm not an expert in that, but if something is suggested by the appropriate engineers as to do this or do that to your living situation, then that of course also need to be done because that's preventative so that ongoing damage can be minimized.
Right, right. Yeah. Thank you, sir. Thank you absolutely for that advice. So, Dr. Ahuja, there is this point I would like to ask you. So, because there is a myth that actually is going on in the society, because especially when we immediately talk about the kidneys, we talk about dialysis. That is an immediate question that actually raises, or the topic that raises. So, there is a myth that if there is a kidney problem, dialysis is the only solution to it. Is that true?
No, that is not true. First
Okay.
of all, dialysis becomes necessary for a person with a kidney ailment only when more than 90% of our kidney function is lost. So
Okay.
imagine you had been suffering, or one had been suffering from a kidney condition for years or months when 85 to 90% of the kidney function got lost and we didn't do anything.
Right, right,
So
right.
we
But
missed
how do
an
we know,
opportunity.
sir? Sorry to interrupt. How do we know, sir, that we have lost 90% of the kidney function? Is it possible for us to realize that we have lost 90% of the kidney function?
No, not by yourself. So this is
Okay.
where preventative or preemptive seeking advice for your condition, if you have some trouble, um, will come into play. But
Okay.
you're right that in most cases, when it comes to kidney ailments, the kidney does not cause too many symptoms
Right.
until we have lost about 70 to 80% of the kidney function.
Oh my God.
So for two-thirds of the kidney function loss initially, virtually there are no symptoms. And the only symptom
Oh,
that may be is that you have high blood pressure or that you have some abnormal test results that you would not know because those do not become apparent unless the blood is tested.
okay. Okay.
So, high blood pressure and diabetes are two most important causes of the kidney failure, and they are responsible for kidney failure in the need of the dialysis for two-thirds of the cases. Out of the
Oh,
100
okay.
cases of the people needing dialysis, 70 to 75% of them will either have high blood pressure or diabetes. And
Okay.
both high blood pressure and diabetes in the early stages for very long period, I should say for decades, does not cause any symptom.
Oh,
So
okay.
the blood
Okay.
pressure has to be checked by a blood pressure instrument, and the
Right.
diabetes has to be checked by a glucose meter.
Glucometer. Yes, sir. Yes.
So the commonly talked symptoms and signs of the diabetes that you would read in the book, or if you Googled it, that you pass more urine and you eat
Yes,
more,
sir. Yes,
and
sir.
those are present in only a handful of patients, a fraction of the patients, and for a
Okay.
specific type of diabetic patients like type 1 diabetes. While
Okay.
the majority of us do not have type 1 diabetes, but we have type 2 diabetes.
Okay.
And
Okay.
type 2 diabetes can remain asymptomatic until major organ dysfunction has developed as a result of the diabetes affecting those organs.
Okay. Okay.
So,
Okay.
if you are at risk of developing diabetes, which will include being overweight, not
Right.
sleeping well, or family history of diabetes, even though you may be eating healthy, even though you think you are taking care of your body, you do not know whether you have early signs of the diabetes, or you do not know that you have high blood pressure. And that's why the condition associated with a high blood pressure, in layman's term, sometimes is often known as silent killer. And the reason
Yes,
it is
sir.
named as silent killer is because you come to know about it when the advanced complication of the high blood pressure cause a life-threatening condition such as a brain hemorrhage or such as heart attack.
Yes, sir.
While for 20 to 30 years that you are suffering from high blood pressure, before a major life threatening condition happens, we weren't aware. Or if we had minor symptoms such as headache, or such as visual changes, or such as some swelling, or such as some shortness of the breath, we ignored it or did not take care of it. Or even if we went to take care of it, we did not go to the right doctor. Or even if we did go to the right doctor, he or she did not refer us to the appropriate specialist after doing our
Right, sir.
initial screening, either because they did not know any better, or because you did not have a means to get to the right doctor,
Yes, sir. Yes, sir.
or
Yes.
you did not have the right questions to ask as to what next I should do, or what next should happen, or how do I prevent damage from continuing to happen.
Yes, sir. Yes. I mean, this sounds very scary, sir, when you're talking about two-third of the cases, the kidney health is going to be damaged by 80%, and that is when public go to the doctors by the time the situation has gone advanced. I think this is a very similar case with the cancer situation also, and few of the other, ailments also, sir. But you see, I mean, especially when you look outside, especially in developing countries, the marketing of these food related items have become so enticing that we just fall for it. The first things that attracts the food is our eyes as well as our nose, and we just can't stop ourselves from eating. So people are eating anything and everything, and people are consuming anything and everything at any time. And they are definitely at a high risk of different types of ailments, including the kidney disease, because kidney is one of the vital organs which filters out the toxins in our body. Correct me if I'm wrong, sir, subject to correction.
That's
So, what is that one advice you want to give to them? Because if this trend continues, I assume, I'm not sure, sir. You can correct me if I'm wrong. Do we have enough kidney specialists, which is nothing but nephrologists around the world? Let's assume India, UK, and the United States to treat such patients, because I see a lot of people eating a lot of food at in every time possible and every type of food. So, what is your take on it, sir? What do you advise to these people? Do we have enough doctors?
so there's always dearth of the good doctors, and there is always shortage of the nephrologist in all countries, including United States, where people lately have not been wanting to go in this specialty because of the variety of the reasons. But that being aside, being a separate problem in its own way, let's focus to your initial part of the question as to that we're eating anything and everything available and all the time.
Yes,
And
sir.
that has become a real big problem in the recent years. So
Yes,
I
sir.
think what we can do about it is go back to our heritage and go back to see or ask as to how our forefathers and our older generations lived. And let's go back to the nature. And the food that is available in the market at this time is highly ultra processed.
Yes, sir.
and we're not eating a diet that is wholesome. The diet that we're consuming is full of the ultra processed meat, ultra processed food with a lot of preservatives, with a lot of other ingredients that even the makers of the food may not know as to what it may be doing. But simply because it's very well flavored, because it's very well suited to our taste buds, we end
Yes,
up
sir.
consuming.
Yes, sir.
And it is not the food directly itself that may or may not be harming our kidney or heart, but it's the weight gain that happens. It's the high
Okay.
blood pressure that happens. And it is the propensity for the diabetes that happens. And then on the top of that, everybody of us is busy and living a stressful life, either for the career reasons or for the family reasons. And then on the top of that, we don't sleep enough
Yes, sir.
and we are busy doing multitasking without focused attention, generating stress in our minds, and that leads to the high blood pressure. So, going back to our roots, going back to our heritage, and trying to live a holistic life with less salty food, with less sweet food or artificial sweeteners, etc., uh, may be a good beginning for somebody. And sometimes we also need to understand that no matter how well read we may be, no matter how well researched we think we may be, we don't know enough. So we
Yes.
often need help and we have to
Yes,
go
sir.
to the expert. And unless we go to the expert, we are not going to be equipped with the right experiential knowledge. I
Yes,
may
sir.
have some knowledge about my car as to how a car functions.
Yes,
But
sir.
when my car doesn't function, I still have to the mechanic, I still have
Yes,
to
sir.
go to the garage and get my car repaired.
Yes, sir.
Even though I may know theoretically that this is how it works, but my home is not a garage. My home is not a mechanic's shop. So I still have to go to the garage and talk to a mechanic and talk to an expert. And
Yes,
if
sir.
he or she cannot fix the car, then they have to refer me to an appropriate person or appropriate garage that repairs the European cars which I might have. And
Yes, sir.
that garage may be only equipped for repairing Indian cars. And if I'm possessing a European car, then I have to go to the appropriate garage and talk to the appropriate mechanic who has the experience in treating or fixing those European cars.
I agree, sir. I
Same
agree.
is same is applicable to our body.
Yes, sir. Yes, sir. Sir, maybe I want to ask you, maybe this helps me also. Can you help us understand how the food gets digested and the remains come out from our body? What is the process that happens in our body? At what stage the kidneys are involved? How long would it take? How long do we not have to eat? Because what we feel hungry. So feeling hungry means does that really mean the stomach is empty? When does it mean the stomach is empty? Can we keep the stomach empty? And for so these are the kind of questions, because what we see is we have to eat all the 4 times in a day. Some people say one meal a day is sufficient till the next day you can sustain with that energy. Again, it's all based on the type of work that we do. But can you start from how? So you eat food from your mouth. Where does it go? Where does the kidney function begins? And how does the food come out? How long does it take for this entire process? How long does it take for the stomach to get empty if we don't eat anything?
So I'm not the right expert to answer that question, but from my earlier readings, because I'm not a GI specialist, but from
Okay.
my earlier readings and common understanding is that we eat the food, it goes through the gullet and goes into the stomach, which is where it is digested or the process of the digestion starts, and then it goes further down to the small intestine, and the larger intestine then sort of uh, makes the stool that comes out um, in our defecation. Um, while the food is getting digested in the stomach and intestine, uh, certain things that were certain nutrients that were absorbed from the intestine go to the liver, and then they are returned to the blood, and then the blood circulates throughout the body, and stuff that is circulating in the body will affect every other organ, including the kidneys. And if there is any noxious substance in the blood that has gotten into our system after being absorbed from the intestine and bypassing via liver, then that can affect the kidneys and other vital organs, because the blood is being delivered to every organ of the body,
Yes,
even
sir.
though, quote unquote, it may be called purified blood, but it's purified in terms of the oxygen, carbon dioxide only, but not in terms of the other nutrients.
Okay.
Um, when it comes to how often we should be eating, most of our eating is psychological. We may not necessarily be hungry.
Yes,
One
sir.
should also remember that we if we had eaten a good meal earlier at the right time, let's say for example at breakfast, ideally speaking, we should not be feeling hungry before the lunchtime, because it
Yes, sir.
takes about 4 to 6 hours for the stomach to empty and contents to go down further and get food digested, and then we should be feeling hungry again. But if we are eating in between, that means we were either thirsty and we simply, instead of drinking water, we resorted to the food because it was easily available or in our sight, or because we're psychologically hungry and eating food simply because it's readily available or in front of us, or we are not focused enough as to ask our body as to what it actually needs. And then, having been used to eating the tasty food or salty food that we get habituated, we continue to expose ourselves to repeated amounts of the food that could have been curtailed by us if we were eating more mindfully, just like our ancestors did, or just like our heritage teaches us, according to the Ayurveda practice, that we should be only eating 3 meals a day, and we should have a time restricted eating, whereby we are not eating after the last meal in the evening before the next sunrise when we break our fast. So, ideally speaking, we should be every day fasting for 12 to 14 hours every day,
Okay.
and not eat at the end of the day and sleep and then wake up again only to eat again.
I agree, sir. I agree with that. Sir, I believe this is something which I wanted to ask you also. Of course, I also have some questions to ask you at the last. These are some rapid fire questions. But before that, you have been in this kidney health field and also medical field for a very long time now. You are the most experienced person in this field. So, over the course of these 3 to 4 decades, when it comes to offering medical support to the kidney patients, what has changed? What is the change that you have observed in the last 40 years?
Like I said earlier, some increase in the awareness has happened. So people who can now afford the healthcare easily, either because they have better jobs or better income, they, on the um, side of the caution, are approaching some healthcare providers. Um, but I would still say that a lot more needs to be done in terms of making ourselves more intellectually aware about the various health related aspects of our body. we could always do better, or we can always better our best. Um,
Right, sir. Sir, I was asking you more in terms of the offering the medical help. Like for an instance, dialysis came in a little later. You know, maybe in your earlier days, I don't know if there was something called as dialysis. Maybe the transplantation of the kidney has come in a little late. Laparoscopic method of removing the kidney stones may have come in a little later. So these are the trends that I'm talking about, sir. So what are the changes that you'd observed? How advanced we are currently in terms of offering kidney surgeries related to kidneys or renal related medical help?
Sorry, I misunderstood your question early.
No
So,
problem.
yes, um, yes. So the dialysis, when I started training in India 40 years ago, was available only at a handful of the places, even in the big cities, even in the big metropolis cities of India. It was available only at a handful of the places. Now, fortunately, more and more dialysis clinics are there throughout the country, and the government also, I hear, has been providing more dialysis care even at the district level hospitals.
Yes, sir.
The dialysis not only has become more available in terms of the locations where we can access it, but the delivery of the dialysis care has also improved over the course
Oh,
of the last 2 3 decades. In terms
okay.
of the technology, we have better machines, we have better filters. Transplantation you touched upon, which used to be also very rare when I trained initially, was again available only at a select few centers. I could say I could count them on my fingers, and now transplant is available in many more cities. But we still are not anywhere near in India as is the developed Western Europe or North America, for that matter. Uh, Going back to the dialysis, peritoneal dialysis, which is a home dialysis modality to treat the kidney failure, has also become more widely available in India. And that's a modality of choice for replacing kidney function where the dialysis centers do not exist, either because we are in a small place or because there are not trained nephrologists available in that city. Um, the drugs that we are using for treating kidney conditions have also mushroomed in the last 2 to 3 decades. When I first trained 40 years ago in India, the medications to treat the blood pressure were far and few in between, and many of them cause side effects. And now we have many drugs that do not have the same side effects as some of the conventional drugs used to have. We have come a long way in terms of the development of the drugs in treating both diabetes and high blood pressure, to the extent that now we can reverse these conditions. Previously, we were only treating the ill effects of these conditions, and we were doing only damage control. And now we
Okay.
have the drugs that can reverse these conditions such that complications of the diabetes and complications of the high blood pressure or complications of the high cholesterol do not happen to begin with if
Oh,
treated early and properly and adequately.
right, right. I mean, that's great. I mean, that's what everyone wants, right? I mean, that's a great evolution that is happening. Dr. Ahuja, again, when we talk about these kidneys and kidney transplantation, every country has its own rules. Who can transplant? Who gets to pick the available kidney? And what are the legalities of it, and etc. I assume, again, subject to correction, there are not enough donors available for the kidney transplants. That is number one. And number two, not enough people know that they're, if any of the family members pass away, they can actually donate their organs, that includes kidneys, which may help someone else as well. So is my understanding correct?
Yes and no, in the sense that the uh, people in the family who pass away, their donors, they can be donors of the organs if they were not diseased. But then that requires a law, that requires a system, that requires an infrastructure, that requires a transportation network that can transport the organs from one state to another state, or one city to another city in a rapid fashion before that organ becomes not usable.
Yes, sir.
So it requires a system that develops over the period and cannot be introduced overnight. Um, so for now, in India and developing countries, I'm not excluding the possibility of the organ donation from the deceased donor. But for now, live related donor, that is an organ from a living donor, is the best option. And when
Oh,
it
okay.
comes to kidney transplant, the outcomes and the survival of the grafted organ is best from a live related donor as opposed to a deceased donor, simply because what I said earlier, that we don't have a system in place that would use the organs of the deceased donor. We have started it now in India, as I hear, but it will take us time to get where Western Europe is or where North America is in
Okay,
this.
okay. Okay, okay. Thank you, sir. Sir, I have few questions to quickly ask you. You can answer them either as a closed-ended answers or an open-ended answers. So you can consider this as a quick rapid-fire round. So I'll start with few. So true or false, drinking lots of water can prevent all kidney problems.
No, drinking a lot of waters helps the kidney flush some of the toxins, but it cannot prevent all the kidney ailments. The most common disorder that can be prevented by a lot of drinking water is the kidney stones and urinary tract infection. Other than that, drinking enough water is seldom helpful in preventing any kidney conditions.
Okay, great. So there are some medicines. These are like non-steroidal medicines that are available, which could be painkillers or something like that. Overuse of these non-steroidal or painkillers are going to affect the kidneys. Is that true or false?
That is very true, and that should be noted and remembered by more and more people. And one should take only prescribed painkillers, and especially when it comes to using non-steroidal anti-inflammatory medications that are available over the counter, should be avoided, especially their regular use or chronic use should be definitely avoided. And these kind of toxins may be or common cause of kidney conditions in the developing world, because the drugs are available easily
Yes,
over the
sir.
counter.
Absolutely. Over the counter. Yes, absolutely. So there is one more question. So, of course, I mean, many of us know this, but I want to ask you again whether it's true or false. You can live with one kidney.
Yes, that is true. We can live with one kidney, provided that one kidney that was removed is um, in early age. So after 70 or 75 years of age, living on one kidney, especially if you have diabetes or high blood pressure, may be difficult. But for most part, yes, we can live with one kidney. God has given us two kidneys simply to be helpful uh, to the rest of the humanity, and everybody should be aware of that. And giving a kidney to a person in the need is not going to jeopardize our health.
Okay, that's what I wanted to ask you, sir. I mean, if one kidney is sufficient, why do we have two? So is the second kidney going to be any more beneficial than one kidney? That's what I wanted to ask you.
No, the God has given us two kidneys because that's the way the destiny was designed by God in an attempt to maintain some symmetry, just like we have two lungs, and just like we have two chambers of the heart, or just like we have
Okay.
two eyes, or just like we have two ears, or two parts of the nose. Um, so, evolutionary reason for two kidneys cannot be discussed by me because I'm not an expert. But suffice to say that when we donate one kidney to somebody else who is in need because of their kidney failure and want to have the transplant, our other remaining kidney overtakes and it becomes bigger and it replaces the kidney function by working harder.
Oh,
So,
fantastic.
any immediate loss of the kidney function that is perceived by the body in the first few days to few weeks is compensated by the remaining kidney becoming bigger
Oh,
and
that's a
function.
wonderful enlightenment you have given to all of us, Dr.
Yeah.
Ahuja. This is something that most of us do not know for sure. So there is one more question I would like to ask you. Holding urination for a longer period of time is going to affect your kidneys. True or false?
Not in the sense that might be perceived by the general population. An occasional holding of the urination by us is very common whenever we are in the situation when we cannot void immediately. But no, I would not say.
Okay, okay. So which demographic of public are more prone for kidney diseases, men or women?
We are equally um, prone, except
Okay.
that the men are more out in the field than women in the developing countries.
Mhm.
And as a result, sorry, men may be more exposed to the toxins,
Okay.
but genetically, we have uh, no preference of developing one condition over the another condition, except for any specific disorder that
Okay.
may be genetically acquired.
Okay, okay. And regular intake of what do you call limited alcohol is going to protect your kidneys. How true is that, sir?
No, it's not true at all. Um,
Okay,
and alcohol in any form is toxic to us, especially the brain and liver. But small amount taken occasionally in the younger years, just as a social use, uh, I suppose is permissible, but it does not protect the kidneys in any way.
okay, okay. So last question. So what is arguably more prone to bring for kidney diseases? Is that a genetic reason or it is diet related reason?
The genetic related kidney conditions are rare, and diet related kidney conditions directly are not common. But like we discussed earlier, diet related other conditions that we become victim of, like obesity, diabetes, high blood pressure, are the conditions that will affect the kidneys and other vital organs of the body.
Okay,
So
okay,
maybe diet can be incriminated, but not in a direct toxin way. But because the diet, especially the diet high in the ultra processed food, can cause overweight and diabetes and high blood pressure and some of the other ailments.
Okay, okay, great. Thank you, Dr. Ahuja. So, lastly, if you have to give one advice with the whole sum of experience that you have been having, I know you have given a lot of advices, but there is something that you should want probably that can be, because you are definitely a person that can warn this generation or the upcoming generation, especially with respect to their kidney health. What is that warning that you want to give?
I'll go back to what I said earlier, that two-thirds of the kidney failure and kidney conditions are caused by the high blood pressure and the diabetes, which in turn is caused by being overweight. So, my advice will be simply go to the doctor every now and then, even when you're not ill, and have your blood pressure checked
Okay,
and have your blood sugar checked, especially if you have the family history of
okay,
diabetes or being overweight, and especially if you
okay,
have family history of the high blood pressure.
okay,
And if any of those readings are abnormal, then follow through. And
okay.
if you did not have any abnormality on your first testing, that doesn't make you immune for the next 10 years. You have to go every 6 months to 1 year to get your blood pressure checked again.
Yes, sir. Yes, sir. Yeah. But these are some valuable advices that you have given us, sir. But absolutely, with the tons of experience you have over the years, especially with respect to in the medical field and also with respect to the kidney health, these inputs and suggestions will at least enlighten most of us, at least a few of us, to ensure that do not wait till the last minute, till you actually damage your kidneys by 80% or 70%. Go to your nearest doctors, get your blood pressure checked and your blood sugar levels checked. At least a small blood test with regards to your creatinine level, subject to correction, sir, can actually tell you the functionality of your kidney and will give you an advice as to where you stand with respect to your kidney health. A stitch in time always saves nine. Ladies and gentlemen, we have Dr. Manohar Ahuja available on our global platform, medicasapp.com. Global customers of Medicas and global public can definitely reach out to him, can have a personal consultation with him, either for a second opinion or for a first time consultation as well. He is available with us. He is taking the time out of his busy schedule and given us few slots to serve the public with the tons of experience he has gained over the course of time. Dr. Manohar Ahuja, thank you so much, sir, for joining in today's podcast. It has been wonderful talking to you. A lot of good advices you have given to all of us. I assume and I believe a lot of us will take advantage of this session, follow through the practices that you have asked us to, and keep our health, overall health, in a good shape. Until next time, ladies and gentlemen, thank you so much. Dr. Ahuja, thank you so much, sir.
Thank you for having me.
Absolutely, sir.